Today, our guest is Michelle Reis.
Thank you. Can I stop you for just 1 second?
Yeah.
It's Michelle Ries.
And I said what, Rice? Welcome to the Brothers and Sisters Like These podcasts. I'm your host, Brother E. Today, our guest is Michelle Reis, President and CEO of the North Carolina Institute of Medicine. Director Michelle, welcome to the show.
Thank you so much, Brother E. And you can call me Michelle today.
Okay, will do. Before we jump into this, let's give our listeners a little bit of a background into the North Carolina Institute of Medicine, which I will just call as NCIOM, and the North Carolina Medical Journal, which I will just say NCMJ. So the two basic parts to this organization are, the first one is the NCIOM, which was started around 1983 by the North Carolina General Assembly with its purpose to provide legislatures with nonpartisan health policy analysis and recommendations. And the other side of that is the North Carolina Medical Journal, which is published and made to inform policy and practices in North Carolina. And it's published by the NCIOM. A lot of those publications are available online. They go all the way back to 1987 and up to the most recent one, which we've been lucky enough as an organization to have brothers and sisters at a invited commentary. And I am a task force member for the North Carolina Veterans Task Force. So having said that, that's my understanding. And please fill in where I left off.
Yeah, no, that was a fantastic overview. I really appreciate you kicking me off that way. So like you said, we were chartered, the North Carolina Institute of Medicine was chartered by the General Assembly back in 1983. So we've been around for a little over 40 years now with exactly that purpose, to serve in an advisory capacity to state policymakers, to state agencies, to other stakeholders across the state about a really broad variety of health issues. I think in our charter, it says something like, to be concerned with the health of North Carolinians. And so that concern, sort of manifests itself in a lot of different ways. And one of the things that you mentioned was bringing together task forces. So we have historically done that pretty frequently, several a year, where we will pull together people from around the state. And that can be physicians, nurses, healthcare administrators, insurers. And then it's also a lot of people who have lived experience with the issue that we're talking about. So we really want to make sure that we're understanding the issues and the challenges that people are facing from the people that are facing them, and that the solutions that we are working to identify are going to be the solutions that are going to be the most impactful for those people too. So we do the task forces, we do a lot of other different types of convenings that are maybe a little shorter or a little bit more narrower or targeted in scope across a lot of different issues too. And then you mentioned the North Carolina Medical Journal as well, where we publish that 4 times a year, and we choose a topic that we're going to go pretty deep on, and we're going to have, peer-reviewed original research articles, and then we're going to have invited commentaries from people who are doing the work in that area too. So again, that can be healthcare providers, that can be community-based organizations, that can be individuals who, are working in the area and have either, sort of insight or perspective about their work that they want to share with us as well.
Excellent. And so how did you become involved with the NCIOM and the NCMJ? Are you a veteran yourself? What experience do you have?
I am not a veteran, and I can talk a little bit about how our Veterans Health Task Force came to be. A lot of the questions that I get a lot is, okay, well, if you have all this broad range of topics that you could look at, how do you decide which ones are the ones that you want to do? And my short answer to that is always, well, it depends, because there's a lot of different ways that we can get topics. Sometimes things are sort of in the news, and things are, being talked about, and everybody says, okay, we got to do something about this. And those are relatively easy. And sometimes we really depend on our partners. And again, those, sort of community organizations, advocacy organizations, provider associations, whatever it is, to come to us and say, hey, this is something that we're hearing from our members or our patients or whoever it might be. And it's something that really could use, a consensus-based action strategy for how we deal with that in the state. And the way that the Veterans Health Task Force came to us was in that way. We actually work closely with AARP North Carolina on a lot of different issues. We've done task forces on healthy aging and serious illness care, hospice care, palliative care, all kinds of things that have to do with older adults in the state. And so we were close partners with AARP, and a couple of folks that were working with AARP on a lot of their work that they do with veterans. They do a lot of work on employment and housing and all kinds of benefit navigation kind of work. They came to us and they said, you know what, North Carolina's having a little bit of a hard time. There's all this new federal legislation that is changing veterans eligibility for different kinds of benefits, and we really could use a little bit of conversation and action planning around how to help some of that navigation. And we think, based on our experience with the NCIOM, that a task force on this and looking at these issues of, coordinating care from the VA and community-based care, understanding some of these navigation issues, understanding, where there's opportunities to make sure that providers are trained in the needs of veterans, supporting caregivers of veterans, all those kinds of things were things that they thought could benefit from our process. And we said, you know what, the more we learn about this, the more I think you're right. And we started talking to a lot of different other partners too, and doing the fundraising that we do to make sure that we could get a task force off the ground that, was the right length and that we could scope properly. We were really grateful for the funding from AARP and from North Carolina Department of Health and Human Services Division of Mental Health for that task force, because it has allowed us to say, okay, we're going to scope this pretty broadly and be able to, do our best to make sure that we're bringing light to the issues that we're talking about.
So not a veteran. You think I forgot about that, but not a veteran.
No, I do have several members of my family who are veterans, though. I have a grandfather, an uncle, an aunt, maybe 3 cousins, I think, across many branches of the military. So definitely, the more I started learning about some of these challenges and issues, the more I said, oh my goodness, and the more I learned how much it's impacting North Carolina. Our veteran population is quite large, and it's something that we really need to be concerned about here in the state.
Yep. So thank you for that, and thank you for the work you're doing. And I see that some of the past task force and some of the past projects have been things like veterans health, immigrants mental health, workforce for health, oral health, local planning for substance abuse and overdose prevention strategies, different essentials for childhood, backbone organization. So some really diverse and important works that you guys are doing, and some of the past ones were like future of nursing workforce, healthy aging, local public health in North Carolina, things that are extremely, so not for the viewers to understand, it's not just individual recommendation in terms of health, but it's like policy. And once you start talking about that, you have to start getting into a whole bunch of things that are much more complicated than simple, best practices. It's how can we pass this legislatively? What makes sense? What do we need from bureaucratic means? The organizations you mentioned, insurers. I mean, there's just so many layers to this, and thank goodness that we have a body that can review these, holistically, and from all those different angles, put it together and give it a product to our legislatures, who then can understand and have a great point of a great starting point to understand what those recommendations are and why they've been made.
Yeah, no, that's a great point. And what we basically do, and this is a little bit of a generalization, but we use a framework of drivers of health in all of our work. And so we recognize that, there's about, I think the consensus is there's about 20% of everybody's health that has to do with what they do at the doctor's office, right? That has to do with clinical care. And that other 80% is everything else. So where people live, where they work, what they eat, whether they have, access to exercise opportunities in their neighborhood, what their income is. There's all kinds of other things that influence people's ability to be healthy. And so just to your point about, we try to look at all of that complexity in any issue that we talk about. And it's very rarely, a recommendation that's around something some individual person should do or not do differently, right? It's all about what are the policy solutions so that our communities and our state can make it easier for people to be healthier.
Right.
So whether that's providing an opportunity for them to have less expensive health insurance, or whether it's saying, hey, we actually know that you need a grocery store in your neighborhood that has fresh produce and that is inexpensive for you to buy. There's a lot of different solutions that we can bring to bear on things that will help people be healthier and make those, healthy behaviors the easier things to do.
Right. So we're looking at, for our military community, more of a strategic look and planning versus an operational or tactical. And so there's so many ramifications. If you say you want to make food more accessible or exercise more accessible, the way you go about those are vastly different. And so you need an organization that understands how to deal with that. And that's might sound not that as hard as it is, but it is very difficult. And you guys have a great staff that we've been working together with so well. And it's amazing to see how over the meetings, our project manager Brianna has, helped transform those into words, and has done a great job of understanding exactly what we meant, and understands our culture and our wordage and our experience. And so it takes really that right people and those right skills to really make it all come together, because it's an enormous amount of work. We've met for hours and hours, and to have, someone from your staff be able to recognize what's important, what's not, and how to put that together is not a small, feat. And so I've been incredibly impressed, and reading over initial, draft reports that we're ready to put out. It's just so well expressed that, our legislators can pick it up and move forward. It's not academic just for being academic sake. I mean, it is a very useful tool. So I want the listeners to make sure that through their website and the links that we'll provide, you guys actually, our listeners actually look and understand what a great opportunity this is for our fellow citizens.
I appreciate that so much. I mean, one of
Absolutely.
the greatest compliments that I think we heard from one of the co-chairs of the task force, Paul Berry, at the last meeting was, he said, I thought you all had a staff of like 100 and you have a staff of 12, and he was impressed with, sort of the amount of
Absolutely.
work and the quality of work. And I will say, I mean, the people that we have on our team are incredibly talented, incredibly skilled. And the basic approach that we take when we start a task force is we say, we want you all to tell us what the problems are, what is keeping us from, optimizing whatever it is that we're talking about. So in this case, veterans health, what are the problems that we're facing? And then what do you see as potential solutions for those problems? And sometimes that can be, something that people are already doing, where we say, here's these 10 organizations who are doing amazing stuff. And if we had more resources and we could expand it, or if we could say, hey, let's hear what they're doing in Asheville and figure out how we can do that in Greensboro, or, whatever that is, building those bridges between people too, so that there's, sharing opportunities, that there's connection on what are those resources, what are the things that make those solutions more possible. And then we, brainstorm and figure out, what is it that we need to ask for, whether that's money from the legislature, whether that's, getting people more on board as volunteers. I mean, there's all kinds of potential solutions that we go through, and we say, what are the ones that are feasible and that we think could actually bring change here?
Well, one thing, Michelle, that I personally enjoyed was the fact that I knew going into this that it's a bipartisan body organization. And what was really good, from a veteran standpoint, is to see that coming in, there was no pre-agenda. It was a real, like, you guys are the stakeholders in your communities. We have them from all the regions of North Carolina. Let's figure out what's working, what's not, where are emerging markets that we need to address. And so that whole conversation was really allowed us, the subject matter experts, to shape the narrative and the direction. And that was, you don't really always find that. And so the listeners need to understand how important that is for us to get really from the actual on the ground location of what's going on, what needs to happen, what's not happening, to the people like you guys that can put all that on paper and have access to the legislative body. So just the way it was set up was incredibly stimulating and refreshing to know that, hey, these guys, aren't here for their own means or for their own ends. They're really here to hear what we have to say and then faithfully represent and ask us, is this what you guys, do you agree with this? Let's go over this. And so it's just been a remarkable experience. And I applaud you and the whole organization for that.
Thank you. I mean, I will say we do work hard to try to make a space that does exactly what you say. And, we've also tried to make sure that our partners and especially our funding partners understand the need for that too, and make sure that they're supportive of our, if it takes a little bit more time, if it takes a little bit more money, that those are the things it's, not just a nice to have, but it's a really necessary part of our process.
It is.
Really
It is
informs.
because let me just step in here, Michelle, and just say that because veterans have an extra layer of sometimes trauma or resiliency too, but there has to be a buy-in, and a lot of times it's not through a government organization that buy-in happens. It happens through people of your same experience. So it's very important that trust be upfront, especially with the veteran population community. And I think that was something that for us was like there was no transitional to that. It was right off the bat. It was let's talk about who's chairing this. You got retired Air Force officer Secretary Millett, who is the secretary of the North Carolina Department of Military and Veterans Affairs. You've got retired Major General Wilmoth, who's now a professor. And you got, as you mentioned before, retired Sergeant Major Paul Berry. So if you don't know these people, let me assure you just at how, it's like, hey, Sergeant Major, what would you like to be called? Just call me Barry.
Right.
Same thing with you, Director Michelle, just Michelle. I mean, it's that kind of access and even playing field where it seems what could become a bureaucratic nightmare or just kind of a waste of time is completely the opposite. So speak a little bit about these chairs and co-chairs and your experience with them.
Yeah, wonderful question. So you mentioned before about, coming into the process and recognizing that it was a nonpartisan process, that it wasn't political, that it wasn't, we weren't coming into it with any kind of preconceived agenda, anything like that. And one of the ways that we try to build that space that is that way is to try to make sure that we have people as co-chairs who represent a pretty broad range of some of the services and the issues and things like that. So by having Secretary Millett, obviously she's at that policymaker level, right? She's going to be somebody who is going to be very aware of what's going on at the governor's office, who's going to be very aware of what's going on at the legislature and can help us with that understanding and those connections there. And then we have Dr. Wilmoth, who is able for us to understand, sort of that provider side. She's a professor at the nursing school at UNC. And a lot of what we've talked about in this task force is that need for development of provider training in veterans needs, right? So she's been able to bring that perspective as well. Paul is at Veterans Bridge Home, and so he has that understanding of a lot of those other types of services that veterans need, and how you work within a community to understand all the various partners and all the various resources that you have. So we had three very distinct perspectives that we were pulling together. To help us understand, because we're not experts in this at all. And when we jump into a project, we say, okay, we need to pull people together even before the task force starts and have a good long planning process so that we understand what we need to talk about, who are the people that we need to talk to. Sometimes we need to have an understanding of the culture, right? This was an area where we actually had some training in terminology and vocabulary that veterans use so that we could understand that when we were planning our meetings and sort of understanding certain things like that. And they were very helpful in guiding that too. And then we also really want to make sure that we've got people who can be spokespeople for the recommendations after we finish them too. And so, they're prominent in their fields and they're going to be able to take these forward and say, hey, this is something that is important. This is a consensus recommendation that all of these people came together and through this worthwhile process, and we think you should do something about it. So we want to have people who have sort of that voice also, and they've been just incredible. The three of them together have been such champions of the work, have been so supportive, have been at maybe not every single meeting because they're very, very busy people, but providing content guidance between meetings, all of that. And it's been a really great process. I think for this task force also, and we talk about this as a staff all the time, the number of people who are on the task force who provide service to veterans who are veterans themselves, that makes an enormous difference in the work too, because people are coming to it in their role as a doctor or a nurse or a therapist or whatever it is, and they're also bringing their perspective as a veteran too, which rounds out the experience and really makes it personal, but also the understanding of the issues is that much more in depth. And we've learned a lot about what that means for how we want to prioritize that type of engagement going forward too. And we do, and we try, and this has been a task force where we just have really seen that just bear such great results, bring such great results in terms of the conversation and the solutions that we've been able to identify. So it's been incredible.
Good. It's very good to hear that. And just for the viewers, let's understand when you're setting up these kinds of organization or task forces, just how important it is to have these chair and co-chairs, because they're the one that set the tone, and they're the ones from which a good percentage of the task force members come from. And very importantly, like you said, Michelle, that coming from three distinct aspects or experiences will give task force members that also come from different backgrounds. And that's incredibly important because no one wants to be boxed into a one view or one system kind of mentality. So, the way this was just picked from the very beginning, and my fellow task members are all, local stakeholders that are just subject matter experts. And so it's just been a tremendously grateful opportunity for us as brothers and sisters to participate, but really to see this kind of effort on behalf of a organization like yourselves to represent and generally help veterans. So it's been a wonderful experience and greatly appreciated.
Yeah, thank you. I'll add one other thing to that
Mm-hmm.
sort of general idea, which is that we really try to get perspectives from all around the state as much as we can too, especially when we're talking about things like access to various healthcare services. We know that, something that we identify that might be helpful in Asheville is not going to be the same,
Yeah,
in the eastern part of the state or
that's
vice
right.
versa, right? So we want to make sure that we're understanding regional issues, local issues, and that can be challenges and great things that are happening. And so
Right.
like maybe this works great here. Can it work well
Can
here?
we, right. Mm-hmm.
Yeah. So really
Yeah.
trying to bring that local perspective so that we
And,
understand all the opportunities.
and for you to appreciate that need is very important, because something as simple as your geographical locations, especially here, for example, in the mountains, but it's really everywhere has different reasons for special attention, but that as good as your ideas can be academically, if there's not a way to execute them, it's only, it just doesn't really come to fruition. So the fact that you are aware that we want to get people to represent from all over the state, because each area has different things that make that area unique, is very good and very important. And it's a very holistic way of looking at it. And not a lot of organizations necessarily think like that. And so I commend you guys for keeping that as an important part of your guys's mantra.
Thank you.
Absolutely. My pleasure. So looking back at some positive effects
Mhm.
that you guys have a proven track record of affecting in North Carolina, is there anything you'd like to say about that?
Yeah, no, I will be a little bit modest here on this one and recognize that a lot of what we develop with our task forces, we're not the only organization that's coming up with those solutions, right? And we're not the only organizations that are working toward those solutions. So I would never want to say, because of this NCIOM recommendation, this happened, because we know that it takes so much. I mean, when we were looking at Medicaid expansion, for instance, which passed in late 2023, it had been over 10 years that the state had been working toward that in the state. And we probably had, gosh, 4 or 5 task forces that were on different things that recommended that the state do the Medicaid expansion, because that improved access was going to help improve care for children, care for pregnant women, all kinds of different things that we were addressing in different areas, and saying, this is one solution that will help a lot of these things. So, we recognized that that was, something that took a long time, and that trajectory, took that long time, but that was ultimately really important and really impactful. So we look back at our task forces and we say, okay, what if this has happened? What hasn't happened? If it hasn't happened, what is the context in which it didn't happen? Was it, because the political context changed? Was it because there was a COVID pandemic in the middle of it? Was it because there's all kinds of reasons for something happening or not happening? In some ways, we've also seen where there's been areas where there's been a crisis that has driven action. One example that I always remember, we did a task force on serious illness care that we released recommendations from that task force. We finished drafting the recommendations for that task force in February of 2020, right? And so we know what happened in the next few months after that. And several of the recommendations that I remember talking about with the task force were about improving telehealth. So, making people have better access to telehealth services. And we had a lot of conversation about, well, I just don't know if we're there. I don't know if the broadband infrastructure is there. I don't know if we're going to be able to make that happen on a quick timeline. And when COVID happened, all of a sudden, within, I don't know, 6 weeks, 8 weeks, something like that, so much of that had already happened, and people were just figuring it out because there was that necessity that was
force the hand. Yeah.
Right. And obviously there were still some infrastructure needs that we're still struggling with.
Yeah.
That, but it was interesting to look back and say, okay, this is a very clear example where there is a context that shifted, and that meant the feasibility of something shifted too. So we try to look back at things and say, okay, what were the reasons that something did or didn't happen? And if it's something that we can replicate, and we say, okay, this is the context that led to something beneficial,
right.
How do we figure out how we can replicate that or push for that change to be broader or whatever it is?
Well, Director Michelle, or Michelle, as you want to be called.
Totally fine. Yep.
I respectfully push back on your pushback, because all the other organizations, it's true, it's a team effort and it takes years. However, you guys have the ear of the legislature, so it's what you guys ultimately putting your all this work together and presenting it, like you mentioned, on sometimes multiple task force coming to the same conclusion.
Mm-hmm.
That's really what puts it over the edge into action for the legislatures. And so I think that we really need to acknowledge that and be very very considerate and very thankful that we have people that are organized like you are, your organization is, to have an effective and productive relationship with our legislators, which can be a difficult thing. And the bipartisan aspect of that is extremely important for them also to buy in as legislators, right? So, that's my pushback. You guys are very well deserved, and I appreciate the way you understand that it is, a group effort. But I appreciate the fact that you guys are the ones that actually kind of close the deal. I think that's fair to say.
Yeah, thank you. I think we also, one of the things that we try to make sure that we do is we put legislators on our task forces too. So we say, whether it's the chair of a specific committee or whatever it is, because we want to have that input as well, and say, if we get the input and it is, this is a no-go in this budget, or this is not going to happen because of these reasons, we want to understand that too, because we want to. That perspective is as important as all the others as well. So we want to make sure that we're reflecting that too. And that also, has such a positive side as well, because like I said about the co-chairs who are spokespeople for the recommendations, oftentimes we have legislators on the task force. They learn a lot about the topic that we're
Mm-hmm.
talking about,
Yeah.
and then they're able to take those issues back to those committees, back to that budget development process. And sometimes it's not even something we've specifically recommended, but a year or 3 years down the road, we see
Mm-hmm.
something reflected
Yep.
in a piece of legislation, and we say, oh, that is because we had those conversations, and that is something that this person had learned about, and that this person wants to make sure is reflected in our state action. So
Yep.
that's
Yep.
it's a great trajectory that way too.
Yeah, absolutely. Yeah, it's one of the ways that maybe not directly, but indirectly, you notice the
Yeah.
work that you guys do. So
Yeah.
here's my take on this, and please, give me the NCIOM take. Is that the more I've gotten into nonprofit and community work, the more I see that something like healthcare, especially for veterans, but also in general for anybody, is incredibly important for a whole list of other reasons, but that it's incredibly important that we address them. So, second, employment, from an employment perspective, mental and physical health are incredibly important to make us be productive in society and work. Child care and child health is incredibly important to make parents have access to go to work, but
Mhm.
also to keep their kids healthy so that they can grow up and just chug along into society, not have any frictions or barriers. Rural healthcare, immigrant healthcare. If these people are in our society and if they're working for us, with us, for the economy, it's in our interest, not only financially, but morally and socially, to make sure that we're providing the best care that's possible and understanding where it's lacking. So, my take is that all this stuff is really, when you stop and look at it, it really contributes to the betterment of North Carolina socially, morally, but also economically. Now, is that something that you have seen as the president?
Yes, absolutely. The phrase that we often use is health in all policies. So when you think about, you mentioned housing. No, sorry, you didn't mention housing. I was
No,
thinking
I
about
didn't.
housing.
But
You mentioned employment, but employment, right? And exactly like you said, is that people need good employment, livable wages in order to be healthy, right? In order
right,
to
yeah,
provide the things that their children need, the things that their families need, and then employers also need their workers to be healthy, right? So they have that interest as well. So when you're thinking about, so what are the things our communities need? Employers want those things. Individuals and families want those things. There's sort of mutual interest in making sure that everybody's got those things. And when we say health in all policies, we also think, okay, well, when you're building a new shopping center in your area, how are you thinking about keeping some green space around and not just necessarily paving everything away?
that's
How are
right.
you incorporating, if you're putting in a new development, a housing development, are you incorporating sidewalks? Are you incorporating playgrounds? Are you thinking about the ways that neighborhood can be a healthy place for people to live?
That's right.
And so there's all kinds of ways that we can think about health when we're thinking about all of the different policy decisions we're making. And so when we work with the legislators, or when we work with anybody, we're thinking about what are the healthcare or health status interests to your work, and how are you thinking about the ways that the decisions that you're making are going to impact people's health too.
And since you mentioned homelessness, for the Veterans Administration at the federal level, the two most important priorities are combating homelessness and suicide prevention. That's also something that NCIOM has been involved with historically. And that also is one of the things that is an impediment to, show social needs and also economic needs. And so dealing with those on one end is very fruitful for our society on different levels on the other end. So you might not think, the listener might not think of this as strictly medical, but it really is when you're looking at the big picture. And that's what I was saying. This has so many flavors and styles, and just it must be a learning experience every time you tackle onto something new, because you're talking about, condominiums. So you're looking at, building codes and getting with the bigger builders, and so I can only imagine the work, but it's a real testament to your guys' attitude. So just tell me a little bit about the learning curve that you guys have to have on these. It must be very interesting.
Yeah, it is. It is really interesting, and I'll use the Veterans Health Task Force as an example, because I mentioned, when we first started learning about some of these issues about care coordination and things like that, we learned about it from our partners at AARP, and we talked to them, and we talked to some of their veteran service people that they have dedicated to those issues. And then we said, who else do we need to talk to? And so we talked to a couple of people at the VA. We talked to a couple of people at Duke University who are doing some research there. We started talking to the Department of Health and Human Services and some of the veteran services that they do there. And this is, again, what you're not hearing is talking to community organizations at this point, or to veterans.
That's right. Yeah.
Because the first thing we had to do was sort of tap our usual networks. And from there, because if I called you up 3 years ago, you would have been like, who are you?
Yeah, exactly.
I don't know. I don't know who you are. I don't know what you want. We didn't have that relationship, and we didn't have that trust to say, like, hey, if I talk to you about your experiences, you're not going to know what I'm going to do with that, or why, or, so we had to start building those networks through the people that we already knew and the organizations that we already knew, so that they could help us make those connections, that we could come in and say, okay, here's who we are, here's what we do, here's why we're asking these questions, build that trust a little bit, and also get information about what are the things that we need to think about. Like, what are the statistics? What are the issues? What are the policy, what's the policy landscape that we need to understand, so that we know where there are changes that can be made and things that we can talk about in the task force. And we have been very intentional over the last probably 3 or 4 years at my organization in telling our funders, hey, you can't expect us to jump in on day one of a project and know everything.
Yeah,
We
good point.
have dedicated time to have a conversation with Brother E, to have a conversation with Paul Berry, to have a conversation with Secretary Millett, to do some focus groups with people about what are the issues that are going on. And that will inform our knowledge. That will inform, how we're thinking about the issues in terms of how we're building the task force so that it will be effective, right? I think that learning phase is incredibly important to help us figure out how the work needs to proceed. We actually put a document on our website that is the learning from that phase, because we thought it was actually really, really helpful to us. And we said, maybe it'll be helpful to somebody else. And it has a lot of sort of personal quotes from the focus groups and from the interviews and everything that our team did, that we said, okay, hey, Brother E says this, we're going to turn that into a priority in the task force, because we're hearing that that's something that's really important. So that might be helpful for the listeners to see that and say, okay, this is how we pulled some of this together.
Yep, absolutely. And
we don't know what we're doing when we start out, and we really do depend on everybody to tell us and say, these are the things that you need to learn, and here's how you need to frame it.
So kind of on that same token, I would like for you to help the listeners understand how they can help participate or donate. But before you answer that, on the donate part, I personally want to step in and show my appreciation for AARP and some of the other sponsors, because from the nonprofit world, it's very difficult for us to secure funding. And I always, as the brothers and sisters, for us, we always reach out to any organization that has helped our cause through funding, directly or indirectly. So we reach out to them to let them know that they've made a difference, and to make them understand that, this is an effort that we really think they need to continue doing, because it is a real difference to the people they serve. So just as a personal note, I wanted to show my appreciation for the sponsors and invite any of them, or possible or future sponsors, to contact the NCIOM to look for partnering with you. Now, absolutely, yeah. For the rest of us, what are some ways that the general public that would like to participate can participate?
So that's a great question. So we're always looking for, as we're building our new projects, we're looking for members for our task forces. They're not only task forces, sometimes they're called different things. We have action committees, whatever it is. And we're always looking for that range of perspectives. And so, if you learn that we are, covering a new topic and you say, oh my goodness, I have experience in that topic, I would really be interested in sharing my perspective on that, absolutely reach out directly to our team. Everybody's emails are on our website, and you can reach out directly and say, I would love to contribute to this in some way. Another way, and this is maybe for people who are a little bit more geared toward wanting to share their experiences in writing. But when we mentioned the North Carolina Medical Journal, we're always looking for commentary pieces for that too. And we have different issues. Each issue has its own topic. And so, you might say, oh, well, there's nothing coming up that really looks like something I'm into, but look ahead a few months and there might be something else that is more, sort of in your lane. And we're always interested in hearing about different ideas that we can feature in that as well. I will say our board of directors is politically appointed. We don't have final say in any of those appointments. So unfortunately, that's not really an avenue for entry in that way. However, when we do talk about, sort of building out our projects and all that, like I said, I think that's probably the best way, is to just let us know that you're interested in sharing your experience and your perspectives. We do have public events pretty frequently. We have an annual meeting in the fall of the year every year. This year is on October 21st here in Raleigh, and we are loosely calling it right now Innovations in Healthcare. And so we are looking at things like product innovations, things like AI tools that are being used in health systems, digital tools, simulations that are being used to help train providers. And then we're looking at process innovations. So things like new workforce models, new types of care that's being provided. And so we're going to be covering a lot of those things at that annual meeting as well. So there's lots of
there are lots of ways, and that's what's so great is the accessibility, whether it's writing or participating. And since you mentioned a date, now the North Carolina Medical Journal has a symposium on
tomorrow.
Actually.
Yes, yeah. I actually didn't mention that because that's probably too late. Okay. But that one we are covering pharmacists as a mechanism for better access to care as well.
Great, yeah.
So we did a journal issue on that about a year ago, and that symposium is being co-hosted by the schools of pharmacy at Campbell University and at UNC Chapel Hill. And it's going to be a great event, really just talking about all kinds of opportunities to utilize pharmacists' role to improve health care for everybody.
Well, just with that example of that date, a couple things come to my mind. First of all, it's one more example of how you guys are in the fabric, of society here in North Carolina, but also goes to show that it was something that was addressed before. You guys have kind of had a after action, review, like we say in the military, and thought, off of that, let's go ahead and have a symposium. So it's just you guys are very thorough and have great thinking of how we've had this conversation. How can we execute on it? How can we improve it? How can we bring it to fruition? So I think the symposium is one of those a tangible effect of a lot of work done before, but that has not been forgotten or just put academically on a shelf. This is the real come to fruition. So very impressive to see that happen.
Yeah, absolutely. And like I said before, we recognize that things change, right? And so if we talk about something today, in 6 months, it might be totally different. So we might need to revisit it because there's new ground to cover. So absolutely.
All right. So we've mentioned ways that people can contribute, listeners can contribute. There are ways we can that they can get in touch with you. Is there any other way other than the website for people to follow or have any updates?
Yeah, so you can follow us on social media. So we do have, we are on LinkedIn and we are on X. We've dabbled in Instagram, but we haven't quite figured out what to post on Instagram. So don't look for us there. But on X and on LinkedIn, you can follow
Okay.
us. And we have a pretty active presence there. And we share, links to our articles, links to our publications. Sometimes we have videos, all kinds of different content on there as well.
And the website is great, full of information, full of references. Uh, I've gotten lost a few times in the sense of like gone from one thing to the other,
Yeah.
and just looking at the data, looking at the information, trying to remember how did I get here.
Mhm.
So it's just great website.
Yeah, and we're always looking for, opinions and advice too on, how can we, get this information to where it needs to go. I think, sometimes we have, a certain type of format that we produce something in. And, if you look at something and you say, this is great, and it would be really cool if we could translate it this way to this other group of people or other type of audience. If you have thoughts on that, we always welcome those as well.
Yep. Yeah, I'll have to say, firsthand lived experience with y'all. If there's a verbiage or a way, we have really seen that our ideas are listened to, and it's amazing. So when you say that, Michelle, you really do mean it, and that's really a good testament to your organization, because it's very humbling to see that happen. To be honest, so good for you.
And I want to give you some kudos as well. I've spent some time on your website too,
Oh, okay.
and the mission and the goal of sharing stories and bringing people together through those experiences is really true to my heart too. So before I went into health policy, I actually was an actor, and I did a lot of theater. And one of the ways that I always thought was so, like, the way people understand things is by hearing people talk about them, and by, sort of sitting together, and whether that's turning something into art, whether that's turning something into, a novel or a poem or a song or whatever that is such an incredible way to, sort of bond and to share those experiences. And I
Yep.
just think it's
Well, thank
incredibly
you.
cool. Yeah.
Thank you. Yeah. So, what we do is that we've noticed that, if I can reference what I said at the beginning of this podcast, or towards the beginning, of how much healthcare affects so much of our lives in ways that we might not initially realize. Brothers and sisters like these is a perfect example, because what we do on the front end is we write therapeutically, not academically, but we write therapeutically to write about the things that we can't really talk about,
Yeah.
sometimes that we can't even really think about.
Hmm.
Write it as a kind of almost like a third party narrative. So you're really reading the information, you're not saying it. And once that liberation happens, and once you start to see that you have fellow veterans just like yourselves that have just stepped up to the plate, become board members, do classes, then you start to say, hey, I don't have a provider. I
Hmm.
said, okay, let me take you to the VA. Let's get you enrolled. So all these other benefits have happened, a lot of health benefits, and much more increased mental health support, because we've had that first conversation, and then we had the buy-in from the veteran, which is the exact same process that you've delineated that you have to have with us being the citizens, in
Hmm.
terms of being not only subject matter experts, but creating an environment where we feel comfortable enough to really engage, come back time after time. And I always tell people that the writing is one part, but to me, where the magic happens is, when we start seeing the other, whole health things happen, like healthcare and a family member coming up to us and thanking us just because they've noticed a change in their loved ones. So it's a team effort, and in the end, all this stuff really is about our quality of life, whether it be physical or mental, or both. So thank you for that. We put a lot of work into that, and I appreciate your acknowledgement.
Absolutely.
All right, so close to ending, but I would like to ask you, what is it that brothers and sisters like these can do for your organization?
That's a wonderful question. So the timeline for the Veterans Health Task Force is coming close to its end. We've finished the general meetings. We're in that process of finalizing all of the recommendations and all of the strategies that we've been talking about for the last year
Yeah.
and some change, right?
Mm-hmm.
And that report is going to be out in the fall. And what we would ask of you is to just take what's in that report and share it as much as you can.
Too
And
easy, Michelle. Too
yeah,
easy.
well, but no, but that's the most important. And say,
You're right.
stand up and say, we talk about your experience with the task force. Say, this was a meaningful experience because of the people that we brought together, because of the, ways that we were able to synthesize everybody's contributions, and say, I think this is a meaningful product that really represents the needs of veterans in our state, and that really represents some actions that we can take to improve
Too
care
easy.
for
Too
them.
easy.
It's
It
not
sells it.
it's easy to say, it's not as easy to do, which is why
Well, that's what brothers and sisters like these. Yeah, I mean, I'm getting off this call and I'm going straight to a new members writing class that we're starting today. So it's just too easy. Tomorrow we have more events, multiple events in multiple locations. We're just engaged.
yeah.
So no, that's too easy. And what's great about this is, as you mentioned, is that the collaboration happens two ways, right? On the front end, you're getting it from us because you're getting the people that understand what needs to happen and how to make it happen. And then we become advocates for an organization that we've been part of in some way, like as a task force member for y'all. So we can promote the findings and actually have buy-in to say, I was actually part of this process, or I know somebody who was part of it,
Mm-hmm.
and they speak like, this is great. So it's just it's a great way of kind of sharing the responsibility, and the honor of improving our quality of lives, whether it's for veterans or civilians, so either way, it's an honor and a privilege, I'm sure, for us as a nonprofit. I'm sure for you, just the depth of the work that you do, it really is an honor. I've heard you and others, like our program director, describe it. But um, before we cut off, what has this experience with NCIOM meant for you personally? What has it brought to you?
Well, that's a great question. So much. I mean, you just said it's been an honor, and I was going to turn that back to you and say it's been an honor for me and an honor for our team too, because we have been really just so impressed with the candidness and the honesty that people have brought to this process, sharing their personal experiences with their service, with their time after their service, sharing, experiences of their family members. It's and I mean, and we do. I mean, we do try very hard to make a space that feels comfortable for people to do that, and we recognize that it takes a lot for people to bring that to these spaces too. And so we really just are so appreciative of all of the time that everybody has spent, of all of the things that everybody has shared. I think, to get back at, some of the data and the, sort of policy challenges, I did not realize how much of a difficult time period that immediate transition time from being in the service to being veteran status is
Yeah.
for people.
Yep.
And, when it comes to connecting to services, when it comes to making sure that people's mental health is where it should be, all of those things, I did not understand that sort of risky time. And that's been really eye opening to me to hear about that and to hear people's perspectives with that transition in their lives and in the lives of the people that they work with. Because of both the sort of policy opportunity and say, okay, how do we focus on improving that time, but also just wanting to make sure that we're always not just thinking, okay, what do we need to do, but who are the people that are who we need to do it for, right? And I think that's been just really meaningful for us to understand from that very close personal experience of the people that we've talked to.
Well, thank you for sharing that, Michelle, because I will say, if I had to pick one topic that is the most impactful but the least known,
Mm-hmm.
transition.
Yeah.
Your period of transition out of the service, especially for a multi-era combat vet like myself, is incredibly a delicate and important time. And I know from the other co-chairs, but also from my personal interactions with Secretary Millett, her own public experiences where she's talked about how,
Right.
you know, what a missed opportunity it was. and is. And we have done on this task force, looked at several ways that we can try to standardize that and make that more important, because that's the one time we have to really capture somebody before they slip through the cracks, so, but good on you for noticing that, because that is an absolutely the most, in my opinion, important point and underrepresented. So good for you. You're very keen and do a great job representing NCIOM.
Yeah, thank you. Well, and thank you
Absolutely.
for this opportunity today to share more about what
Yeah,
we do and, a little
absolutely.
bit more specifics about the task force too, because like I
Absolutely.
said, it's been a great learning experience, and we really do think we've
Absolutely.
landed on some good actionable steps that
That's right.
our state can
Yeah.
take. It's been
All
great.
right. So we'll be looking out for the November, I believe, release date,
That's right.
and
Yep.
still got some work to do, but we're on the downhill part of that. And so, Michelle, our time has come to an end. And as always, to you, our guest, the last word.
Thank you. That's all I got to say.
Well, my pleasure, Michelle. Thank you so much to our listeners. Take care.